Chairman of the House Rules Committee, Congressman Pete Sessions, joins me now to discuss today's meeting with President Trump and whether Republicans have the votes to move this health care bill to the Senate. Good evening, Congressman. Thanks for being here.
Brett, I'm delighted to join you, and thank you very much. This is a very important opportunity for the people of this country to see how democracy plays out, and the votes are going to happen on Thursday, and we're preparing, as you know, by the President being here this morning and by us moving forward tomorrow at the Rules Committee, where people can really learn more in-depth opportunities about why this bill is necessary to repeal Obamacare.
Congressman, you know, you say that you're going to get across the finish line, but you look at the head counting today, and you've got, by our count, currently leaning no or no 31 House GOP members. Talking to Jim Jordan of the Freedom Caucus earlier, this is what he said about the bill.
I think opposition is strong within the Freedom Caucus, very strong. So, you know, we'll see what happens over the next 2 days. Unless you can put in the language that's going to bring down the cost, bring down the cost of premiums, bring back affordable health insurance, unless you can do it in a way that's consistent with what we told the American people, again, this bill doesn't do that. So that's what we're focused on accomplishing.
So can you change the bill in your committee hearing all day tomorrow enough to get these people to change from no to yes?
It's to be seen, Brett. I will tell you a lot of it is in communication and articulation about the bill. Obviously, a decision has been made to allow Obamacare recipients to stay on the Affordable Care Act for 2 more years. That is going to have a lot to do with the cost of the program for 2 years. But in the process, what we're going to do is actually move to a stable, understandable system whereby some 30 million Americans that today do not receive the tax advantage, they will be getting these tax credits. And certainly members of our conference, even the most conservative, would have to be for the American people having a chance to have health care and to have a fair shot at or a fair deal of receiving their health care on a pre-tax basis. What does that mean? That means that fewer people go to the hospital, the emergency room, to receive their treatment, and that is a cost saver. So it's embedded within the bill. We probably just have not been doing a good job to specify where those additions or corrections or changes will be a benefit to reducing the cost.
The countdown is on here, and you're counting heads, and obviously if you can get it across the finish line in the House, there is no, as you mentioned, guarantee that it'll get through the Senate. You've got Senator Tom Cotton coming out saying he's against it, even with the amendments. You've got Mike Lee today saying he's against it. Ted Cruz, Rand Paul. There's a lot of opposition, not to sound negative, but you had the president up there trying to cheerlead. Is he pushing a rock up a hill here?
You know, I don't think so. I think when it really comes down to it, most of these members on the House side, notwithstanding what the Senate might do, the House side has an opportunity to look at, are we getting a better bill and a better position for the American people, and our party? And the answer is yes. And then let it go to the United States Senate and let them debate on a 51-vote basis about what they think is the best plan. If Ted Cruz wants to vote against it, then let the man vote against it. If others do, let them stand on their own. But I think there will be overwhelming evidence by that time that this is a better bill than what we have today. There may not be a second shot at this opportunity.
Last thing, Congressman, and that is the president up in that meeting today. Apparently he said, and you can confirm this or not, I honestly think many of you will lose your seats in 2018 if you don't get this done, or something to that effect. You come from a district in the 32nd district in which Hillary Clinton actually won your district over Donald Trump, and it was surprising. You, of course, won re-election with 71% of the vote there. Are you worried about even if you pass this, that it doesn't sit well with the American people, and then suddenly you own health care in a way that perhaps is not what all that you think it can be?
Brett, as you remember, I was chairman of the National Republican Congressional Committee for 4 years when we first defeated Nancy Pelosi and then redefeated her again to hold the majority. If we as Republicans will do away with Obamacare, repeal it as we said, and replace it with something like what we're doing, we will be in a strong position with the American people, because we're going to take away the taxes, the mandates, and we're going to move 30 million people to have a chance to have fair health care. And that is a strong benefit for us, because it's the middle class of this country, the exact same people that voted for Donald Trump.
Well, Mr. Chairman, we will follow it. We'll follow all of your committee hearings tomorrow and the vote on Thursday. Thank you, sir.
Thank you.